Westbrook Health Services has been supporting the surrounding community since 1949 and is known as an agency that is community-focused, people-driven. As one of West Virginia's 13 comprehensive behavioral health centers, Westbrook provides services to 8 counties throughout the Mountaineer State and became one of the first comprehensive community behavioral health clinics in West Virginia in 2020. This podcast wouldn't be possible without the generous help of the Sisters Health Foundation. This year marks 25 years since the foundation awarded its first grant, and we couldn't be more grateful for their support. Welcome to Studio 2121.
Welcome to Studio 2121 podcast with Westbrook Health Services. Today my guests with me are Jenna Carr and Rob Dudley, and they are with Coplin Health Systems. They collaborate quite a bit with Westbrook. We do many great things in the community together, and we thought it would be good to sit down and talk about some of the services that we collaborate on and to explore everything that Coplin's doing in the community. So, how are you guys doing today?
We're doing great. Thanks for having us.
Thank you.
Yeah, absolutely. So, for those that might not know, Coplin has utilization of office space at our 7th Street location. I have 2 clinic rooms. A lot of our behavioral health clients take advantage of this for their primary care needs. One of the reasons we started this collaboration, often individuals with behavioral health needs have shorter lifespans because they don't often get their medical needs met. And so this has been a great collaboration for our clients to help them get those needs met. And Rob is a former employee of Westbrook, and that partnership has been, I think, a really great help for the community. So, do you guys want to talk about a little bit what we do at 7th Street?
Yeah, absolutely. So I think it's really convenient, and like you said, it's access to care. So those clients that you have that are mutual patients of ours are there for services at your location and then are able to stop right over and see their primary care physician. Transportation is a huge barrier in the Mid-Ohio Valley, and that saves them an extra trip, and it gives them that access to that primary care physician that they might not get elsewhere. And then they've got pharmacy services right there on site for you as well. And it's been wonderful. The partnership really has. We're able to treat hepatitis C as well. So I know that's a big need in the behavioral health community, in the general community in our population and area, and our provider there is able to offer those services, and she's had success with that, great success with that. So
yeah, that's with the substance use population that we serve, bloodborne pathogens is a common issue that goes untreated with undiscovered. So yeah, that's been a great help. And we also have a lab that can draw blood there and do those testing as well. So it's been really good. Another collaboration that we have with Coplin, we have a mobile MAT unit, medication assisted treatment program, and they've been gracious enough to let us park it in their parking lot in Work County to assist with individuals of that need. So gracious that you guys let us do that. I'm not sure how's that been going so far.
It's been slow, but the fact that we can offer it to the community is what is important. Our providers, in particular Dr. Nichols, has the ability to prescribe on an individual basis some of the MAT scripts. However, the other services that traditionally go along with MAT, we do not offer. We have felt that Westbrook has MAT programming, and even though there's been offers for us from the federal government to open MAT programming, to me it just makes sense to collaborate with our partners who are already doing it. So this was an opportunity for our small county in Elizabeth to have access to these services.
Yeah, so with our mobile unit, as Rob said, we're able to connect to therapy, peer support services, along with the medication management as well. And I think we have 2 or 3 clients now somewhere in that neighborhood, and we're welcome. We have room for more. So if you are listening from Work County and you know of individuals that are struggling, we're here to help in any way we can. So And I didn't mention this in the beginning, but Coplin is an FQHC, and so one of their tasks is taking care of the Medicaid population. So that's something else we have in common, and a lot of just standard practices out there actually don't offer a lot of services to Medicaid, and to go along with that, dental care is a very important need. And so you guys have started a dental clinic as well, not too long ago.
Yes.
How's that going?
It's going pretty well. We consume the practice that used to be Dr. Michael Cox, and that's been a few years ago. So now that is Coplin, the technical dental care, and we have 2 physicians now, or 2 dentists now, and several hygienists and assistants working on getting patients in the door, and we do take Medicaid for dental, so it's really nice to have that opportunity to give somebody a smile back, and be a part of that. And I know Medicaid kind of puts a gap on what they pay for dental services, but working with those patients to work out, here's a treatment plan. I hear our site director and our dental coordinator talk about that all the time, about we're going to work with you to create this dental plan of what's the most important thing for us to address right now, so we can utilize the funding that's available to those Medicaid patients to give them some, pride back in their smile. So
yeah, that's awesome.
And statistics show that oral health issues lead to physical health issues, and some pretty major physical health issues. And so part of the idea with the FQHC is that we put all types of services around the patient that influence health and wellness. And so dental is one of those areas that is recognized as having a major influence on physical aspects of health.
Something I learned the other day that I didn't know, this is new information to me, you guys might be aware, with medication-assisted treatment that we were talking about, one of the medications is Suboxone, and that's strips that you put in your mouth and you dissolve. Individuals often that are taking Suboxone start suffering with oral health because they don't get it treated, and that medication actually causes some oral health issues. So we are trying to educate our clients that are in the MAP programs about the importance of getting dental care and getting their oral health taken care of. So that's another thing that we probably, I don't know this, but I imagine our staff is starting to refer clients to your dental clinic through our MAP program because of that issue.
And another way that we've been able to utilize you, it's been a super amazing thing to be able to call your crisis team in if we have a patient in the office at any of our locations that needs help further than what we can help them with. A lot of our patients are very open-minded to getting that help and are ready, and we've been able to call them, and your staff's been willing to come right over, and we've been able to get the patient the help and the assistance that they need, and that's been a huge benefit, and it's just such a win because you see the difference from when they walk in the door to when they're leaving, and they have a group of people that are there to support them, and they didn't that they're not leaving alone. So that's been a huge win, and thanks to you all for being there.
Yeah, thank you for that. Our crisis team, they love that. They love reaching out, finding those individuals, and trying to offer some hope. And they're really good about connecting that. That's great. So you guys have started a newer adventure out at WVUP. How's that going?
So we're doing primary care, and we're doing some behavioral health out there as well. And then we're doing acute care services. So we're open Monday through Friday, 8 to 6. Open to the public, students and faculty of WVUP, current patients. So just really getting that up and running, and looking at how we can continue to grow that in that area out there. And it's still Parkersburg, but Davisville area is welcome to come too. And we just look to continue to grow and get our name out there and make people aware that the services are there. We have a provider there that's always willing to see whoever needs help coming through the door.
I think one of the things I've learned over my time with Coplin is that any collaborative venture takes time to not necessarily have the idea, believe that the idea can happen, but actually putting it in motion. And so this was one of the projects that when Dr. Gilmer was there, we met several years ago. It took about 5.5 years to make that project a reality. And we put some really neat things around those services to the school that is a benefit for young students who may be coming in that do not have parental insurance any longer.
Okay.
And so we've come up with some good ways for them to be able to afford health care. And so we're excited about that program. And again, it's early in the life of that particular clinic, so we look forward to seeing how it grows in year 2.
That's awesome. I think about my college days. I didn't go see a doctor. I was invincible at that time. So that's what kids think. So it's great that there's that reminder that you need to take care of yourself, especially at that age.
Yeah.
So that's awesome. So one of the so we're working to bring CCBHC to West Virginia. I've talked about that on the podcast before. But one of the really exciting parts is bringing a care coordination model to the agency. So that will give us the ability to hire staff whose sole purpose is to manage a caseload of connecting clients to all their care needs. So as we're able to bring that aboard, I see our collaboration growing. We'll be able to hand walk clients, back and forth between the two services and get everything taken care of. So that's something new coming that I'm very excited about. I was talking with Jenna before you got here, and we were talking about, we have our Mother's Day race this weekend, so this podcast will come out after the race, but you guys have one coming up in June to help support individuals suffering with diabetes.
Yeah, it's be the 7th year Dash for Diabetes in Ravenswood. And it's just putting a race together. It does take some coordination, but it's not a lot of heavy work. So knowing who the contact and getting it in the River City runners, of course, is a big thing to draw some of the local runners and walkers. But it's a great race, pretty flat course. I call it a PR course. So but you can come and you can walk. You can volunteer. You can hand out water. You can walk your pets on the race. So we're pretty open as far as those who are looking for a nice activity. And there's also the competitive part of it as well. So we enjoy hosting that event, and we use that money to help with diabetic needs for our patients.
Which West Virginia is one of the worst states with diabetic needs. And that's in Ravenswood, is that
yes.
correct? And there's that Riverfront Park.
Mm-hmm.
Yep. Well, good. I have not ran it yet, but I'm going to try to run it this year. I'm excited.
And knock on wood, we've always had pretty good weather.
Yeah.
At least the past 5 years we have. So
that's great.
Yeah.
Well, good deal. Well, Rob, just full disclosure, Rob and I actually had daughters that were in the same age in school, so we often talk to each other about how they're doing. So I'm kind of curious, how's things going with Rylan?
She's doing well.
Yeah.
When she was a sophomore, she was diagnosed with type 1 diabetes. It came out of nowhere. It doesn't run in our family, so it was quite a surprise to her, to all of us. She's done an amazing job of managing it from the start. So she played basketball then, and so that was the first year that Parkersburg High School went to the States and won, and it was with mainly her team that she had played all the way up through with. So she was excited about that, and it didn't stop her from doing the things that she enjoyed. whether it was swimming or walking, hiking. She continued to be involved and learn how to dose with her diet, with her insulin, so that she was able to continue to pretty much lead a normal life. Even knew how to eat fast food, which I didn't encourage, but
Right.
they figure that out pretty quick when they're that age.
That's great. I think I saw her last night walking in the park when I was running.
Yeah, she just finished her RN degree out at WVUP.
Oh, great. Awesome.
So now she has to get licensed, and
Yeah.
then she can take care of me.
Yeah. We don't know anybody that might have a job for her if she chooses to do that. Yeah, nursing is a big need right now.
Yes.
So that's awesome. Well, good. Congratulations.
Thanks.
So,
And your daughter?
well, Madison just finished her junior year at the University of Richmond. She's actually running tomorrow in a conference called the Eastern Athletic Conference or something. It's called ECACs. And she's running the 1500. She won last weekend the Atlantic 10 Conference Championship in the 1500.
Awesome.
So she is 2 seconds, we think, 2 seconds away from making regionals for NCAA. So she's got to drop about 2 seconds from her best time this year. So we'll see. That's her goal tomorrow. So
It's awesome.
yeah, thank you.
Congratulations.
Yeah.
I was just today talking about, I ran track in high school, and I was all state in track and field, and we thought it would be fun one time to trade our 4x4 team for our 4x8 team, because the sprinters thought that the 800 would be fun, and that was the last time, the first and the last time we ever traded the 4x4 for the 4x8, because distance was not for us at all.
It's a different animal between a sprinter and a distance runner, that's for sure. Yeah. So, well, good. Well, I hope everyone has enjoyed our podcast today. And if you have primary care needs, reach out to Coplin. They can address those for you. If you have behavioral health needs, of course, Westbrook can help you there. And our Christ line is always open for anyone that needs to talk, 485-1725.